I am Rick Buck, and I've been a dentist for 15 years. In this video, we will go over most of the possibilities as to why your gums may be receding. Like and subscribe if you have teeth. When talking about gum recession, we start with the different possible mechanisms or pathways causing your gums to recede, and then the possible causes that trigger those mechanisms to happen. Because you see, there are multiple reasons why your gums can be receding. And once we understand those possible causes of your gums receding, only then can we possibly stop them from receding. Let's start with the most interesting cause of gum recession, which is gum irritation. I think it's interesting because a lot of the people that think they are really doing good at taking care of their teeth are actually doing a bad job and causing gum recession. You see, our bodies have different ways of reacting to different irritants. We develop rashes, calluses, and with your gums, they will actually move away from irritants, which is what you can see as gum recession. So what I'm saying is, over time, the gums will actually migrate away from irritants, especially continued and daily irritations. Let me go over a few of the common irritants that cause gum recession. The first is brushing too hard. I see so much of this, especially with people that are fanatics about taking care of their teeth. People want to really take good care of their teeth, and this is good, but they start brushing very aggressively, or they start using a hard bristled toothbrush. This will cause your gums to recede and even possibly become sensitive. In fact, any gum recession can make your teeth sensitive. To make it worse, gum recession leaves the roots of your teeth exposed, and the roots of your teeth are not made of the hard enamel that the upper portion of your teeth is made of. So they will start to abrade and wear away. This abrasion of the roots of your teeth will look like little or even big notches in the teeth near the gum line. For a lot of people that develop the notches in their teeth, they're unsightly and they can catch a lot of food in them. But a dentist can normally cover those notches with a white filling to help them a little bit cosmetically. For aggressive brushers, the main thing to do here is simply stop brushing so hard. Watch my video that will pop up at the end of this video that will show you the best way to brush and floss daily. I will show you why brushing hard is not necessary and give you a better way with better products to take care of your teeth. But in that video, I will show you the best way to get your teeth spotless every day and get stunning results that you will be able to see in that video. But the point here is lightly brushing with a soft bristled toothbrush is the main way to stop recession due to aggressively taking care of your teeth. But while the toothbrush is the main contributor to gum recession, your toothpaste could also be a huge contributor. You may not know this, but toothpastes are tested on how abrasive they are, and they're given what we call an RDA score. The higher the score, the more abrasive the toothpaste is at wearing away your teeth, especially the roots of your teeth. The American Dental Association and FDA recommend using a toothpaste that has an RDA score of less than 200 and 250. But I don't think there is reason to use any toothpaste above 100. For example, here's a chart of a lot of toothpastes and their tested RDA scores. You will notice a lot of the whitening toothpastes that don't use peroxides to help whiten with high RDA scores. I will go over this more in my toothpaste videos that I'm currently making and testing out. But hopefully by the time you're watching this, those videos are already done. The point is, stick with my favorite dental products as I recommend very low abrasive products. And what's funny is the more abrasive products aren't even as good as some of the low abrasive products. Anyway, your toothpaste may be too abrasive and irritating the gums, causing them to recede as well. Actually, the bigger point is doing anything, even flossing too aggressively to your gums, can irritate them and cause recession. So, for example, some people have lip rings right here and they rub up against the gums and cause gingival recession because of so much irritation and rubbing of that ring against their gums. Other people I've seen have aggressive toothpick habits, or even gum stimulating habits. Then there are other people that think they see a cavity or other problem with their teeth, and then all of a sudden they become obsessive and very aggressive at trying to reduce it or take care of the cavity or other problem they see to try and clean it. But what they're really doing is just irritating the gums every day. In some cases, your gums can even sense dental work like crowns and fillings and will recede just a tad. You see, your gums are just passive aggressive, and if they hate an irritant, they start moving away to avoid it. Okay, let's move on from gingival irritation to another huge possible pathway that is causing gum recession, and that is gum disease. And it's probably more common than gum irritation at causing gum recession. So here it's important to know that the foods we eat today are so bad for our health, especially eating things like refined sugars and too many carbs. Let me further explain. The bacteria in your mouth colonize in the plaque that is stuck to your teeth, and that plaque reforms every day. Then what happens is those bacteria take the sugars that you eat and they process them, and this causes those bacteria to proliferate and eventually destroy your teeth and gums. The bacteria that is in that plaque that's stuck to your tooth and your gums will even dissolve the ligaments and the bone that hold your teeth into place. Then, as the bone level starts to decrease, the attached gums follow them, which causes gum recession. Now, I just explained that sugars are the main cause of this. Unfortunately, I know most of you won't go to a very low carb diet or very, very low sugar diet, but you should. An interesting study I read one time showed that there were people and they were put on this Stone Age diet that was void of refined sugars. So after a few weeks, virtually their gum disease had disappeared. And the thing is, they didn't even have better brushing and flossing during that time. They just stopped the refined sugars and were put on this old Stone Age diet. So stopping sugars is the main thing. But if you're not going to a very low sugar diet, then a great daily tooth care routine is very important. Once again, everyone should watch my best daily brushing and flossing routine video. Now that being said, if you have already developed gum disease, brushing and flossing will do very little to help you until you've had a deep cleaning, where a hygienist will remove all the bacteria that has hardened and attached to your teeth like barnacles. That plaque and bacteria attached to your teeth and gums is the source of the infection, and so until that is gone, there's not much you can do to control the gum disease. But to beat a dead horse, if you have gum disease, step one is getting into the dentist for likely a deep cleaning. The number one indicator you may have gum disease is if your gums bleed easily when flossing. This is just almost a dead giveaway that you have at least some degree of gum disease. I should mention here that smoking also helps gum disease progress rapidly too. So get into the dentist if you have easily bleeding gums or they're very sensitive to the touch. The next mechanism of gum recession is tooth movement and tooth position. So let me explain, and let me start by explaining that the bone on the front or cheek side of your teeth can be very thin. Now keep that in mind as I explain this other part. In layman's terms, when your teeth move, your body lays down new bone where the tooth is moving away from. So if it's moving this way, it's laying down new bone behind it. But it will also eat away at the bone in front of the tooth or in the direction that the tooth is moving. Now, it doesn't just remove the bone, because then what will happen is it will then lay down new bone in front of it as well to reinforce the tooth in its new position. The thing is, your body has limits onto how much new bone it will place down in front of the tooth as it moves. So if your tooth is moving past those limits, it will lose bone in the direction the tooth is moving. And when it loses bone, once again, the gums follow, and this is what causes gum recession. So you might now have two questions. Well, are my teeth moving? I don't see them moving. And then second, you might want to know what the limits are to how much the tooth moves. Let me start by talking about the limits to how much a tooth can move. There are three main limitations, but only your body knows the actual limit amount. Though orthodontists have a good idea too, and I will explain what those limitations are. But once again, only your body knows the actual amount. First, obviously, there is a limit to how far forward the tooth can move before gum recession starts. Basically, you can't move the tooth forever in one direction. Second limitation, there is a limit to how fast your teeth can move, and how fast your teeth move is determined by the total force or pressure on that tooth. So there is a limit as to how much pressure a tooth can take before the bone starts to recede and there starts to have gum recession. Third limitation is there's also a big limit to the direction the tooth moves. Essentially, you're likely to get bone loss and thus gum recession if your tooth starts to tilt forward on an axis instead of staying upright when moving. You want the whole tooth to move in the upright direction with very little tilting forward of the tooth. Of course, there is a little bit of tilting that the tooth can do, if you need it to move that way. Now you may be thinking, this is lame, my teeth aren't moving. But you should know your teeth are actually constantly making minor movements throughout your whole life. However, there are some things that will increase pressure to cause gum recession due to the movement. Obviously, having braces will cause your teeth to move. However, if the orthodontist for some reason is not careful, you can get some gum recession due to the movement of these teeth. But normally, unless you get a bad apple, the orthodontists know about this and they know how much movement your teeth can take before this starts to happen. But the more common cause of gum recession due to tooth movement is clenching and grinding of your teeth. This can be really bad because excessive clenching can put a lot of tilting force on your teeth, and for some people, it's just too much pressure and will cause gum recession. Check out my video about clenching and grinding if you have a suspicion this is happening to you, and that way you'll know why this might be happening. But basically, there is a lot that might be causing you to clench excessively, and there are a few things you might be able to do to minimize the clenching. As a dentist, I give my patients botulinum toxin or Botox in their jaw muscles, and I also prescribe night guards to minimize the clenching and its effects and the possibility of gum recession due to those. But I never do this before we evaluate other things that might be the root cause of their clenching, like medications, taking too many vitamins, sleeping positions and pillows that are too hard, or extreme diets, or workout plans. These are all possibilities as to things that might be causing clenching, and you should watch that video if you have a suspicion of any of that. Moving on. Age is another mechanism of gum recession. There are some people that are genetically programmed to have a little gum recession as they get older, and there isn't much you can do about it, but it is important to know that it does exist. Also, missing teeth are another cause of gingival recession. If you lose a tooth, the bone socket will collapse as it heals, which in turn will cause the bone of the adjacent teeth to recede a little bit too, which ultimately causes gum recession once again of the adjacent teeth. I've went over many things to help stop gum recession. But apart from doing those things, there are gum specialists that can help restore gums that have receded. Now, the results these gum specialists can get are normally limited, but it may be worth a shot for you if you want to see if you can restore some of your gum recession. Remember, my favorite toothbrush, floss, toothpaste, and other dental products are linked to below this video. Everyone should watch my daily tooth care routine video I have posted now, and I will show you why in that video it is the best technique to brush, floss, and much more. This video is part of a larger series of oral pain issues that I am making, so you can match the symptoms we talked about here to the possible diagnosis that you might have or the treatments that you might need. That way you can further narrow down and find the cause of your issue and hopefully find a remedy or possibly see a dentist that can officially diagnose and treat your issue. If in Southern California, my dental office is linked to below. Like and subscribe if you have teeth.